1995. I've been doing motivational interviewing since about the same time. Fortunately, when I was getting my master's degree in New York at Columbia, my professor was really interested in motivational interviewing. So I was getting to do work with people with opioid use disorders, really knew the field and learning motivational interviewing at the same time. So it was really a great thing for me. Let me see. Okay, there we go. So these are our typical mentor global learning objectives. As you all know, in this 7 to 8 a.m. session, we have kind of 8 rotating topics. And motivational interviewing is typically the second one that we do. You'll see it come up in the MAT, or I should really begin to need to pivot to the MOUD. It's going to take me a minute. The MOUD literature in terms of being a helpful intervention, because really you can do a lot with it. You can do it from, you can use motivational interviewing to address diversion. You can use motivational interviewing to encourage people to go to a higher level of care. You can use motivational interviewing to help people abstain from alcohol or some other substance that they're abusing. So you can do a lot with it. So what are we going to do? We're going to look at some motivational techniques within motivational interviewing, to talk about some of the relational and the technical dimensions of MI, and then appreciate some of the specific skills to evoke change talk. So last night, I've seen her twice now. So this was the second part of our psychiatric diagnostic assessment. And so this is a woman who is 36 years old. She's white. She's upper class by her own definition. She really recently went to detox for alcohol use and then also for cocaine. So she meets criteria for a severe alcohol use disorder and a severe cocaine use disorder as well. So she's pretty new into the recovery process. The issue that I was having with her is she's also in a domestic violence relationship. She lives with her husband, and her husband is physically and verbally and sexually abusive toward her. She describes that relationship as a real trigger for going back to using, which would make sense, right? You're kind of terrorized in your own home, and in a way that she had dealt with that was through drugs and alcohol. And she also was raised in an environment which is not uncommon. As a child, she was physically, sexually, and emotionally abused by her own family members. But you know, as you know, with people with domestic violence issues, like any other behavior, there's reasons why people are in the relationship, and there's reasons why people would want to get out of the relationship. And if you're going to tell a person, hey, you know what, you just need to leave that guy, typically that's not going to be helpful. It's not like they haven't heard that before. In this woman's life, everybody in her life is telling her to leave this person. She even knows intellectually she should leave this person, but there's reasons why she stays, right? So that's what we'll try and unpack some of that as we go through. So definitions: a collaborative conversation style for strengthening a person's own motivation and commitment to change. That's one of the definitions. So you can really see it's highlighting collaborative. So you're not just telling people what to do. In collaborative and MI, you as physicians or nurse practitioners or pharmacists, you have your expertise, right? Obviously, but your patient also has their expertise. They know what they're willing to do. They know what they're not willing to do. They know what they've tried in the past. They know what they would never try. So it's really around kind of bridging those two, making a bridge with those two people and their expertise to come up with a plan. And what you're really trying to do is the argument is you can't really create motivation for somebody, right? Like you can't put it in somebody. But what you're trying to do is begin to at least increase their awareness that, okay, maybe they should, or maybe they'll begin to identify, I do need to make a change. And then you kind of fan that flame of helping them get more motivated and commitment and having more commitment to change. I just realized I got preoccupied. Kay, say hello, Kay, real quick while I'm in the middle of this. Sorry, I left you out. You're working on the holidays, so that's really rude.
Good morning.
Good morning. So another way of defining it is arranging conversations so people talk themselves into change based on their own values and interests. So I'll give you an example of this. So this woman I'm referring to from last night, one of the things that she wants to do is she wants to go back to being a teacher. And why does she want to be a teacher? She wants to be a teacher because when she was a kid, teachers were the people that she felt safe with. As I mentioned, there was Tara in her home, and teachers were really the only people in her life that were affirming and positive and where she felt safe. So last night, even I asked her questions like, what do you think it would be like to be a role model to other kids while you're still in an abusive relationship? And even in my tone, hopefully you noticed it was really just a wondering. It wasn't like, well, how are you going to be a role model to these kids if you're all messed up yourself? You know, obviously someone's pretty much not going to react well to that, but it was a really even keeled. And then what I was trying to do is I know that what she cares about is being a role model. What I know that she cares about is giving back to other kids. So what I was trying to do is ask a question with a neutral tone that helped her think about that discrepancy, right? I want to be a role model. I want to help other kids. And yet I'm in the situation where I'm not living up to that, right? And, you know, even asking that question, she was incredibly tearful and was like kind of angry at herself in the session saying, I know this is so stupid. I've got to make a change, So that's kind of the ways when you're talking about arranging conversations so people talk themselves into change. You need to know what are their values and interests, and then wonder how their behaviors intersect with it. In another MAT related thing, I had a patient pretty recently. I do this a lot, but this guy actually was really invested parent, and you know, wanted his children to overcome struggle and to face scary situations, right? And at the same time, this guy's afraid to go to meetings, even though we'd identified that could be a helpful place for him to begin to build a support network. So I was asking him questions like, you know, what kind of role model do you think you could be for your son if you were able to face this scary thing head on and do it? And he was like, yeah, you know, that's right. Like, I need to be able to be an example to my kids, not just tell them what to do. So really in MI, ultimately, you're trying to figure out what does the person care about? What do they value? And one other example of this, I have a lot of people I've worked with in the past who identify with a particular religion, and the religion is actually salient to them and important to them. And maybe let's say they believe in a higher power. And I've asked things like, what's it like? How does smoking crack affect your relationship with God? Again, in a really neutral way, how does smoking crack affect your relationship with God? Because for many people, that's also incongruent, right? I don't say, well, you can't be a Christian, or you can't be a Muslim, or you can't be Jewish if you're smoking crack. Like, you know, God doesn't like that. I would never say that, obviously. But just to ask the question, and for many people, that's this real kind of like, oh my gosh, it's really true. Like, I'm not being the best Christian, Muslim, Jewish person I can be. I need to make a change. So the spirit of MI, it's sort of broken up into 4 categories. So there's partnership and collaboration. So, you know, with this woman last night, I was saying, okay, well, you know, it seems like we have 3 things that you can do, right? One thing is you can just stay in the relationship with this abusive, I didn't say with this abusive guy, but stay in a relationship with your husband. And, you know, just keep doing what you've been doing, basically. That's certainly an option. The second option is you can leave your husband, right, and go somewhere else. And a third option is that you could figure out ways in your house to stay safer right now. And those of you who aren't in so much steeped in the domestic violence world, there are specific strategies you can talk about with people so that they can stay safer, even if they decide to stay with an abusive partner, because that happens so much. I never would say safe, but safer. And then asking her, you know, any other ideas you have of those 3 options, what makes the most sense to you? right? So it's really around, okay, I share what I know, she shares what she knows, and we kind of come up with an idea of what might be helpful. Acceptance, so accurate empathy. So part of when you're empathizing with anybody about a behavior, really what you want to understand from them is what do they like about it and what don't they like about it. So some of the things I asked her were, what are the reasons why it's really good to stay with your husband? And she mentioned she has a very affluent lifestyle. She does not want for anything financially. She has status in her community based on her husband's position. She is afraid to be alone. All she ever knows is people who've been abusive. So are there actually people out there who are not abusive? This is an open question to her. All that makes sense, right? I get it. I get why she would stay in the relationship. And then I asked her, okay, so that, that all makes sense. You do get a lot from the relationship, and there's a lot you'd be afraid of giving up. And then to ask her, on the other hand, what are some of the drawbacks of being in this relationship with him? And that's where she talks about how she believes it's going to be next to impossible to remain sober. Remaining sober to her is important because it is consistent with her own religious values. It is also consistent with her goal of eventually being a role model to other kids who've been through the same thing. And she also is very aware that living a life of terror is taking a toll on her mind, her body. She doesn't like who she sees in the mirror. So the idea is really just to get a sense of, like, from all aspects, how does this person think about this behavior? And obviously, just using the 12-step example is you can do that too. What are reasons why you would never go to meetings? What are reasons why meetings are scary? What are the bad things about going to meetings? And on the flip side, what, if any, benefits do you think there would be to go into meetings? What might be the benefits? What do you think good might happen, right? Absolute worth, I think, is really important with our folks. Sometimes they come across as cocky and arrogant and maybe even a little bit narcissistic. I know I used to when I was in the grips of my addiction, and I would say, and I think many people would say, it's kind of like a defense, like you kind of have this hard, overly confident shell sometimes, which is really just because you feel so worthless inside. And so you'd rather kind of go on the attack or what have you. Is that hard to deal with? Definitely. Does that sometimes get under my skin? For sure, even though I see it myself from my past. But really, some people do come in much more kind of openly, like expressing a sense of worthlessness. But I think in general, our folks are wounded. Certainly the woman I worked with last night was incredibly wounded. So absolute worth is really just kind of communicating the good things about somebody and how they deserve better, and trying to kind of acknowledge the type of person that they can be and they want to be, and seeing them as somebody who's worthwhile, and not being another person who kind of beats them down or dismisses them or talks over them. I think even just hearing somebody out and not interrupting them is a really nice way of showing that they're worthwhile, taking the time to understand them. Emphasizing autonomy. So with her last night, I'd said it like 5 times. Hey, this is your life. You get to decide what you do next. I'm here to support you. I'm here to talk through your options. I'm here to troubleshoot with you. At the end of the day, though, you get to decide. And to Dr. Goldman's point with adolescence, that's one of the developmental tasks of adolescents in general, is to begin to kind of experience their own autonomy, right? They begin to ride bikes around the neighborhood. They go to school on their own. They begin to have friends that you don't know about, which is all normal and healthy and part of being an adolescent. And most people beyond adolescence like to feel like they're in charge, and ultimately they are in charge. So it's just acknowledging that, and that they have the power to choose what they're going to do. And affirmations is just that it also helps with the absolute worth, but it's catching people being good. So with my person last night, and I do this with a lot of people who have survived trauma, is I kind of, and it's real, I'll say something like, wow, you were such a survivor. How the heck did you get through all that? You're incredible. What does it say about you that you could do that? Your honesty talking about this is remarkable. and just being specific, getting people to talk about their own positives, catching, acknowledging things that are worthy of affirmation. I always use this example too. If you do a talk screen, and the person says to you before the results, hey, you know what, just so you know, I smoked some crack this weekend, so you're going to see cocaine come up in my system. I think that's a wonderful time to affirm that person. It doesn't mean there's not going to be a consequence, but the first thing out of your mouth can be something like, wow, I give you a lot of credit for being so honest. You didn't have to do that. It takes a lot of courage. Now let's talk about what that means in terms of our treatment together, right? But there's no reason why you can't affirm that honesty up front. And you might say, well, yeah, you're going to find out in the talk screen anyways. You all have had patients who have said, that lab messed up. That wasn't my urine. So people will, if they don't want to be honest with you, they won't be honest with you. Even if you have it in black and white in front of them, people will say, no, that's a mistake. You made a mistake. The lab made a mistake. So why not affirm it? It doesn't mean, again, that there's not a consequence, but you can affirm and then there can be a consequence. Compassion is basically just stick to your ethical codes. This is taken from the third MI book, and they put it in because people were doing things like using motivational interviewing to encourage people to join research studies and things like that. Which any of you all who've done research know that that's not how you do it. You can't. It's unethical to compel people to try and influence people to join your research program. And then other ways that people were doing to kind of pad their coffers by influencing people to do things that they didn't really need to do. So don't do that. Stick to your ethical codes. And evocation is trying to bring out a patient's own reasons for change. So another example, an example of that was, again, my patient last night was religious and believed in kind of this notion of God having a plan, right? And I had a feeling that God's plan for her in her own mind was not to continue to be in an abusive relationship. That was my hunch. I wasn't sure. You never know. So I said, well, what do you think God's plan is for you? And then she, of course, espoused all kinds of things that were incongruent with being in a domestic violence relationship. So again, it's any way you can get the person to talk themselves into change. When I'm teaching medical students this, I oftentimes do this example with exercise, and I will ask people, so I'll ask you to think about if you have not been exercising, if you've exercised a lot in the past, but you're not exercising now, right? I want you to think about, and in MI, you would talk about what was it like when you used to exercise regularly, right? And so I'll pick on a medical student and say, well, what was it like when you used to exercise regularly? And they'll say something like, I felt so much more relaxed. I felt way more confident. I slept better. I actually was eating better because I cared what I put in my body. And my kind of point with that is that a lot of times we tell people, hey, if you exercise, you're going to sleep better, you're going to eat better, you're going to be more relaxed, is way more powerful when you get the person to say it themselves, right? Which is why I do that little exercise. The difference between educating people things they already know versus not. Another example, when I can pull on from Cuyahoga County with evocation, is that we know that there's another big, I think it was 60 somewhat people died in Cuyahoga County in May of an overdose. And it's an increasing rate of those folks who had been using stimulants, or at least obviously it was then cut with fentanyl, but they thought they were using stimulants. So again, I could educate somebody. I could say, hey, you live in Cuyahoga County and you need to watch out because they're put fentanyl in the cocaine. Or I could say, hey, what are you hearing about what's happening to the cocaine out there? What do you learn? What are you hearing about people ODing? And have them say, yeah, it's scary. One of my friends overdosed from smoking crack, and I didn't even know that was possible. So it's way more impactful to get them to say it, if possible, than for you. Although sometimes they may not know, and then you have to educate them, right? So these are things you're generally trying to do if you're if you're, I mean, you're not trying to do if you're doing MI. So persuading people without permission. So if I were to say to her, you know, you just really need to leave this guy. You know what's best for you. You need to leave. She's heard that 500 times. It's not going to be helpful for me to say it. All it's going to do is make her not want to talk to me anymore. Confronting her. This woman's had people she cares about a lot more than me confront her about this relationship. So why don't I do something different and not confront her? Having a premature focus of, no, if I'm going to work with you, you have to leave this guy. Then she's just not going to work with me, right? So I'm believing that I need to get a hook in, form a relationship with her, and help her gradually make that decision while we work on other things like experiences of her trauma from the past and on her dealing with the triggers that she can, or the high risk situations that she can right now not to use. Labeling people. You know, some people don't like to be referred to as even a domestic violence survivor, and even like the term domestic violence, or being an addict, or having a substance use disorder. I don't really care about labels. Symptoms, yeah, symptoms are important. Can we agree these are your symptoms? Okay, that's cool. We don't have to put a label on it. I may have to put a label on it for billing purposes, and I'll let them know that. But we can just talk about your symptoms and not the label. Blaming and shaming people, educating people without listening. Most people, when I ask this to medical students too, I say, "What? Tell me about bad encounters you've had with your own physicians." And they'll say, "Well, they just told me what to do and they didn't even know me." So yeah, well, let's try not to do that then. So basically, people are much more inclined to hear you out if you've taken the time to listen to them as best you can. So the MI skills are asking open-ended questions. So things that they can, so as opposed to saying, have you been taking your buprenorphine, which will get you a yes or no, saying, what's it been like taking your buprenorphine? Oh, it's been pretty good. I've been da-da-da-da. So you get them to talk more. Affirmations, catching people being good, reflective listening, summaries. So an example summary from last night was I said, okay, so on the one hand, you want to continue to stay with him because of the lifestyle that he offers for you. You like really being privileged in your community. You're scared to be alone. And on the other side, you can't even sleep at night because you're so scared. You can't even look at yourself in the mirror because you don't like who you see. And you believe that you're not living the life that God had intended for you. So it's just kind of summarizing. You end on the reasons why they might want to change. Informing with permission is if I were to say something like, would it be okay if I share with you what the research says about domestic violence? And then she says, sure. And I would say, well, typically what we believe is that the violence escalates over time. So what might be less violent initially, over time will get more and more violent, even with the perpetrator saying they're not going to get more violent and they're going to stop. And then I would say, what do you think about that? And then she said, yeah, that's exactly what's happened. And I'm scared that I may not wake up one morning, right? So it's asking permission to educating, then wondering what they think about it. Here's 9 specific strategies you can do to get the person to talk more about change. Evocative questions. So I said something to her like, tell me more about what it would be like to look in the mirror and think of yourself as a role model for kids. Like I really wanted her in that space, right, to talk about that more. Elaboration, kind of similar to that. Tell me more about like what it's like trying to go to bed at night. What's happening to you? What are you thinking about? Just to kind of get her in that space of the nervousness that she feels. Give me an example. Give me an example of some of what he's done. So again, those kind of details can help with promoting that change. The decisional balance, the pros and cons, which we talked about. Looking back, so that's where I really learned about her wanting to be a teacher. I said, well, you know, before you got into all this, and you know, you were 18, 19, 20, thinking about your life. What did you want things to be like? Who'd you want to be? What'd you want to do? Looking forward, kind of similar to things I've already mentioned. If you were to wake up a year from now and you were exactly who you wanted to be, things were going how you wanted it to go, what would you be doing? Query extremes. I did ask her this the first time I saw her. What's the worst thing that happens if you continue to stay in this relationship? And that's where she said she would wind up dead and be a statistic. And then on the other hand, I said, what's the best thing that happens if you leave this relationship? That's where she said I would be a school teacher, and I would look at myself and feel confident, and I would be sober, and I would be proud of who I am. Importance and confidence rulers on a scale of 0 to 10, 0 not important, 10 very important. How important is it for you to leave him? And she would say, I didn't ask her this yet because it's not quite time. She said, or she would say like a 6. And I would say, okay, how come you're a 6 and not a 3? You ask a lower number because that elicits those reasons, whatever it is that she's thinking about changing. If a person says a 0, which definitely happens, then you learn they are really in pre-contemplation, and then you just empathize. Okay, for you, it's not at all important to leave this husband right now. Let's think about what else we can work on. Sometimes just exploring goals and values in and of itself can help with promoting change. Even people getting in touch with the person they want to be. Even for you all sitting there right now, I would bet that none of us are exactly living in a way that's consistent with our goals and values, kind of human nature. And then when we're aware of that, for example, if we have a value around health, and we're aware that we haven't worked out in 2 weeks, then we might be like, you know what, I really need to think about working out because that is important to me. So sometimes just making it really salient to the person, because sometimes we don't want to think about what we're not doing. And I'll skip that. These are just some of the research that suggests that MI can be effective with this population. And I took a lot of time intentionally, because I knew that we had a small group. So any questions, thoughts, reactions people have?